Hi, guys. First of all, I'd like to welcome you all to our very, very first episode on this platform, Get to Know Her. I have a very, very, very special young lady joining me today, and I'm so, so happy she could do this today. Caitlin Ochana. Some of you may know her as Miss Uganda UK 2021 or 2020. Some of you may know her as Miss International, second runner up. Yeah. Some of you may know her as a pageant coach, because she started to help young girls and women out there to get into pageantry and be their confident selves. But I know her as Caitlin Ochana, the best girl and liveliest girl you will ever meet. Now, Caitlin actually advocates for endometriosis, and that is her platform. So she will be explaining a couple of things regarding that, giving us a little bit of advice regarding that, and educating us in general, because I'm sure, like me, you have no idea what endometriosis actually is. So help me welcome Caitlin Ochana. So, Miss Girl.
Hi.
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 How are you?
I'm fine. How are you?
Doing good. I'm doing good now that I'm here.
As you should. So you now have your platform, Public Cervix Announcement. First of all, let's get into that name. How did you come up with that?
Right.
Why did you want to create that platform, and what's the purpose behind that?
So my platform, Public Cervix Announcement, was originally there to kind of push a public service announcement to menstrual health. Like, we hear about these stories about infertility, about PCOS, all these other menstrual health diseases such as endometriosis. Why are we not doing enough as a community to raise awareness on endometriosis and what we can do to speak up for ourselves in the doctor's room to ensure that we get the right treatment? So Public Cervix Announcement is all about educating the wider community about, of what endometriosis is about, as well as documenting my journey so I can share my experiences of what it's like to live with this disease and how I go about it and how I get the correct treatment, because it's not easy to get, the right treatment. It's not easy for the doctor to hear you the first time. And so I kind of use advocacy as like the skill to kind of get what I need for myself to ensure that, this disease is going to be here with me for a long time.
Yeah.
How can I make sure that it's manageable at home as well as when I go to hospital as well?
Yeah, no, of course. And what is it? What is endometriosis? Should I hear that? How do I figure out that I have it? How do I check? Where do I go? What is it?
So endometriosis is a disease, a chronic disease, that's the lining of the uterus. It grows elsewhere in your body. So it's a full body disease that people don't normally know. So it can grow anywhere. It can grow within your bladder, within your reproductive organs. It can even go around your heart. It can literally grow anywhere.
Right.
And in terms of how to check for it, so in order to be medically diagnosed, you have surgery. So you have a keyhole surgery. But looking at the symptoms, we hear, oh, I have, really bad period pains. These period pains are so bad. When you hear the word pain and period, those two should never sit very well together. From the moment you're throwing up, you're in fetal position, we have become so normalized to believe that all of these symptoms every single month is normal. Absolutely not. That is your sign to book that GP appointment and to kind of tell your GP, look, I'm going through this every month. Is this normal? If not, what can we do? Because at the end of the day, period pain is not normal
At all.
Really
it's not
isn't.
fun.
It's not fun, staying at home for 2 days when your life is on pause. Like, our periods should not, hinder our lives so much to the point where we literally cannot live. And so from the moment you find that there's a hindrance to your life because of your menstrual cramps and your pain, book that GP appointment and see what's going on, because you just never know. You just never know.
No, definitely, because I think, just kind of like reiterating what you just said, with the pains and whatnot, we don't really think of it, because I feel like we just expect it and we're like, oh yeah, it's normal, it'll go away after a week or whatever. But actually it could be something more serious. So yeah, definitely
And
go.
1 in 5 women will have endometriosis.
Okay.
And as a Black woman, it takes about 7 to 10 years for us to be medically diagnosed, whereas our white counterpart, it will be 5 to 7. So it is very important, especially as women of color, to really be in tune with our health, especially our menstrual health, because you leave that a little late, that's when infertility comes in play.
Mm.
That's when, increased mental health issues will come into play, and we just don't. It's so avoidable if we act now, and that's why my platform is all about acting now and advocating for yourself. Because at the end of the day, our healthcare system, it is amazing, but they still have a long way to go, especially for Black women coming with menstrual health issues.
Yeah. Okay. So you have mentioned, of course, that extreme pain being one of the symptoms, and of course that throwing up. What else could I look at and be like, that's not normal? It might be endometriosis. What else is there that I could look out for?
It's the back pain. Leg pain is also a huge indicator that, okay, this is something out of the ordinary.
Mm.
Extreme fatigueness, pain during sex is a massive indicator that, okay, this is something that I need to get it checked out. And my saying is hashtag book that GP appointment.
Straight away.
Straight away. It
Straight
doesn't
away.
hurt to book a GP appointment. It doesn't hurt to push for that ultrasound.
Even if you feel stupid, do so.
And it's because it's your body, nothing is stupid.
Yeah.
Once you get the ultrasound, once you get your blood test, you will have a clear picture of what is going on. And this year, when I was diagnosed with endometriosis, I was diagnosed with a form of endometriosis called ovarian endometrioma, where you have chocolate cysts, which is basically old blood in the form of a cyst.
Right.
When they told me that, I was so relieved because now there is a name to my pain. Whereas before, this pain's been going on since I was 16.
Yeah.
And a lot of girls, 16 is that age where things change for us, especially when it comes to our menstrual health. Every single year, every single cycle, you're going through a level of confusion. Why am I in pain? Now there's a name to your pain. Okay, how can I live with it? Because although it's a chronic illness and it's long term, you can still live.
Yeah, you're not in the dark about what it is.
You're not in the dark.
Manage
you've got
it, yeah.
pain management, you've got the correct medication, you've got the correct holistic plan, and you've also got your support system, your family and friends. They now know what to do with you as well, because this is a journey for not just one person, but for many as well.
100%, 100%. No, definitely. Now, you said, of course, you go to the GP when you experiencing the symptoms and whatnot. And what is that process like? How long does it take?
Right.
Does it stop? Do you have aftercare? What is that like?
Right. So the process, it is kind of daunting and long because, like I said, you really do need to push for yourself and advocate for yourself to get things done. Because essentially, we're in this cycle, and I know many girls can relate, where you go to the GP, complain about very bad period pains, and then they give you the contraceptive pill, the birth control, and now you're stuck in this cycle of just putting a plaster on a stab wound. We are treating the symptom, not the cause. And so what I do, I always go back. Always go back. If you do find yourself, if it's every single week going to a GP for the same thing, they're going to get the message that, okay, this patient, she's seeing me every week, we need to now escalate it to the hospital. Pushing for the ultrasound. And for me, one thing that really helped, especially as a Black woman, if I do find that they're refusing a certain treatment, I always ask them to write it down on my records. So there is a trail behind. So there's something that the doctors, the gynecologist can see. Oh, actually, she was refused, an ultrasound or a further blood test when she pushed for it. Let's now investigate as to why it wasn't done then. Let's do it now. So always make sure, be stern with yourself. I think for me at the start, when I'm confronted with a GP or a doctor, I get kind of, intimidated. Oh my gosh, they went to medical school, they know the whole body, but they don't know your body. You know your body so well. No one else knows your body the way you do. So be your body's biggest cheerleader.
Yeah.
And the least you can do is be the biggest advocate for yourself, because this can very much benefit you long term for when you want to decide to have children, when you want to decide to have a family. So yeah, the process is daunting, it is long, but that consistency of pushing and keep pushing and pushing for the right treatment, it does help.
Yeah.
It really does help.
No, for sure. Now, I know you've given us advice in terms of we need to speak up for ourselves. We need to be expert patients because you know your body more than anybody else does. What other advice would you give somebody like me or somebody who may be going through endometriosis? What should they do?
I think number one would be take care of your mental health. When you go through something so traumatic, because this is so much trauma to the body, it can take a toll on your mental health. So, in order to make sure that mentally you are at an okay position, talk about it with your family and friends. That sounds so cliche, guys. It really does, but
It helps,
it
trust me.
helps
It really
so
does.
much because they don't want you to take on this whole load. They understand the severity of what endometriosis is and what it means to live with it. So by talking about it with your family and friends and keep them in the loop, they also want to help you take on this load. This is, like I said, this is a communal journey. You should never go through this journey on your own. And if you do find yourself going through this journey on your own, Endometriosis UK is an amazing charity that helps women across the country that go through this illness, with the amazing support system, amazing volunteers that love to chat with patients that go through this. So you are never ever alone. Always talk about it. Always find someone to have that discussion with because it really helps. It really, really, really helps.
No, thank you
Yeah.
so much. Now, I know you said just to finish off, we go to our GPs when we see those symptoms. Of course, we speak to our mothers. Is there any other kind of online support we can get to learn more about endometriosis, or even just to reach out to get that help?
Public cervix announcement, guys. Honestly, the page, I document my journey, and what you would find on public cervix announcement is vulnerability, relatability, and just rawness. A lot of people assume that a little colorful post will do the trick, but I think it's different when you're seeing someone who is experiencing the rawness of the pain, experiencing the rawness of the emotions, and kind of connecting with that post. It really, really helps. I follow a lot of charities. Endometriosis, again, they are an amazing charity that always posts about what's going on within the community, how can we help, what to do. Also, the NHS, they really help. Always speak to your local gynecologist about it. Just the resources are everywhere around you, and social media is like the best way to start because there's a lot of pages, a lot of platforms like Public Cervix Announcement that really share our stories on there. So you can also think, actually, hold on, she's going through what I'm going through, so I'm not going crazy. I'm going to be okay. There's an element of relatability there. And so I think starting off, with the Public Cervix Announcement as well as other social media platforms that you can find definitely helps.
Yeah.
100%. Yeah.
No, thank you so much. That was very
worries.
insightful. I feel like I've been taught something.
Yes.
I'm taught something. I'm learning.
Listen, we're all about, surrounding ourselves in teachable environments and just spreading awareness, and conversation like this definitely helps.
No, thank you. And as Caitlin has already told us, the specialist that you look for, if it's not the GP, you're going to go for a gynecologist.
Yes.
That is who you're going to ask for to help you look into that issue a little bit more. Thank you so much for coming.
Thank you for having me. I appreciate it.